All right, we're recording. Hello, gentlemen.
Hello, hello.
All right, so we had some good traction last week when I put up the video about nerve entrapments in general.
hmm
We talked about the different areas in the body, 256 different regions in the body, right, Zach? 256, that's a lot of places. But what I wanted to talk about today was the two most common areas in the human body to get a nerve entrapment, which are also the same area where you're going to get the most amount of scar tissue in the human body. So let's take a little quiz here. What is the most common area in the human body, Steve, to accumulate scar tissue?
It's be the neck.
Yes, where specifically in the neck?
Coming right through here. So
And
going means
which muscles are we going to see it in?
the levator.
What else?
As far as here,
Yeah.
levators coming down through rhomboids all the way up to MCEs. Through here's the whole traction, traps, you name it.
We're not going to see it as much in the traps, but we're going to see it very
Well, I
pronounced.
mean, I'm sorry, rephrase that because it's overlapping with the levator, so that's where I'm getting that.
Yeah, you
So,
can catch it a little bit there, but that's going to be the area where you're going to get it the most. So let's take a little journey of the accessory nerve. So accessory nerve is one of the cranial nerves. I bet you remember that from your massage boards, the cranial nerves. There's 12 of them. There's
yes.
only a few that actually leave the brain itself. One of them is the accessory nerve. Accessory nerve comes out right behind the ear, goes down, fans out a little bit to the front here to control some of the SCM, and then goes back down through here. So we talked about nerves, and what are nerves built with?
Slack, about
Slack.
10%.
10 or 15% to allow them to make the way where they're going. So what's the problem with the accessory nerve in modern society and everything that we're doing?
Everything is sitting, rounding forward because we have bad posture because we're on computers, and it's constantly putting pressure on the muscles surrounding the nerve, which ultimately removes what slack is in there. So
Yeah,
it's
so
constant pressure.
the nerve gets pissed off. And we talked
Yeah.
about that. When the nerve gets pissed off, everything else tightens around there. Now, the problem with accessory nerve treatment is it forms and gets stuck to those muscles in there, and it forms a lot of that scar tissue. So what do people like to call those, Zach, when they feel this thing in their neck? And what do they call it? A knot. And I'm like, what the fuck does that even mean? But it's not a knot. It's actually scar tissue. So what does traditional massage tell you to do to that, Zach? What would they tell you?
Press on it in a couple different ways, iterations.
Yeah. Or what else would they tell you to do, Steve?
Beat the shit out of it.
Beat the
Honestly,
shit out of it. I got a
just dig
podcast
your elbow
coming.
in.
I got
Deeper
a
is
podcast.
better. Exactly.
Yeah, we have that podcast coming out next week. I don't care about critical thinking. I'm just going to massage the shit out of it. And that's what happens. But what are they messing up, Steve? Because that nerve, it isn't very deep, is it?
No, they're putting too compressive, which sends all the mechanoreceptors haywire, so it feels good in the moment, but they're not making any actual changes in the area. They're just confusing it and making it feel different, but not better.
Yes, and that is just a temporary fix because all it's doing is relieving some of those symptoms. So people keep coming back. They're like, oh, this knot keeps coming here, but nobody's addressing it. So
because the knot never actually left. That's the problem.
yes, all you did was got it firing and got some blood flow and all that, but it comes right back and they're right back into those positions. And nerve entrapments are really a big problem. So we teach in the training, and Zach, you've been learning about the training. There's two components to treatment, right? And what are they?
Depth and proper tension.
Yes, and I always say the words depth and then proper tension. So what does everyone want to do?
Everyone loves depth. They just dig in there and go deep as possible, because that's what everybody likes. That's why deep tissue is so popular, because they think it's the right way to go.
Yeah, it's got to hurt like hell. You got to dig in there, just dig that piece of shit out of there and go in there, and you're not doing anything. And people, they've been ingrained in that. So a nerve is even more important because it needs proper depth, not as much as you think, and then tension. Then you throw in all the craziness of the thoracic spine and the transition zone of the cervical spine, where things start moving in different ways and there's different angles. So you have to account for the curve of the spine and the thoracic spine. So what happens is people are way too compressive and they don't get enough tension. Tension is what breaks that down. And that's what's happening for people is they're not addressing that area correctly, and these knots keep coming back. So what do we do?
As far as like treatment goes,
Well, what do
it's
you,
about
you use your brain and you start thinking about stuff. Like, I'm amazed at how many massage therapists want to go in there like blitzkrieg bulldozer and just massage the shit out of it and beat it up, but they're not fixing anything. So the key is in the details.
Yes.
And the depth and the tension. And that's what you guys have started to learn over these last couple of months.
Yeah, and I think that's where it's even harder as a massage therapist to get into the areas because it's having self-control. Everybody wants to be a deep tissue therapist. It's become sort of a cult pride about, who's the best at doing deep tissue. So having the self-control, especially for a couple of meatheads like us, to not put more pressure is more difficult. It's easier to throw your body into it because you just lean. But having the proper control, which requires much better mechanics and a stronger touch, more detailed touch in what you're hitting, is not easy to learn. It's not hard to do once you learn it, but those specific movements are not easy to learn. So.
And Zach, what is the question that we always ask before we do treatment or we interpret what's going on? What is that one question that we ask?
Patient and quality, is that where you're heading with that?
Yeah, and even more of like a broader statement. Why?
Yeah. Mm-hmm.
Why is that happening? Why does it hurt in there? And we tend to be, I always say we should be client focused in our marketing and our message, but we tend to be way more client focused in our treatment. We're like, well, it hurts in there. They expect us to go in there and dig at it because that's what they expect. And it's like, well, it's not working. And the client doesn't expect anything. They expect you to fix the problem. Yeah. And if you're not fixing the problem, you need to do some interpretation of why that problem's happening. And nobody wants to do that. They want to jump right in to treatment.
We get down to the rabbit hole of chasing symptoms when, as we know, one area can cause 3 very different symptoms or more. And then you get stuck in a loop not knowing where you're going. And that's where people get in trouble all the time. When you have a client that you just can't fix, it's because you're chasing an effect, not a cause.
Yeah, because you're doing the same thing. And what is that the definition of? Zach?
Insanity.
Yes. See, he stole your thunder. So that's what we're seeing and understanding that and learning to think about what's going on, knowing that list and what we talk about in our training. Is it a bone problem, cartilage problem, ligament problem, nerve problem, tendon problem, soft tissue? Did I forget any? Nerve entrapment, one we're actually talking about. And slowing down, like that's the key. You have to go slow to go fast. And if you're not fixing these nerve entrapments, you're not fixing anything. So good stuff. I hope that helps.
Yep.
All right.